So my understanding of headaches is there are multiple factors that can contribute, right? Lifestyle, genetics, and the overall environment that you may be in. Bright lights, sounds. How can someone who may be triggered by some of those help prevent headaches in that way?
I think a good first step, and something that I always discuss with my patients, is if you get headaches or regular headaches, first step is to keep a headache log. One of the most important things is just identifying how frequently you get them. But important things to pay attention to is quality of sleep, how many hours of sleep per night you're getting, how regularly you're eating, maybe your stress levels that day. And for women in particular, also their menstrual cycles, as hormones are known to play a role in headaches, especially migraines. So I think the first step is to keep a headache log, and it can really help patients identify triggers that could be contributing to their headaches.
Sadly, I've heard women are 3 times more likely to suffer from headaches, which that's a crazy stat. But talking about some of the food choices, right? You mentioned sleep, but also just, I'm thinking myself, caffeine. I live off caffeine. Can you talk about some of the maybe food choices that someone could make that either trigger or can prevent headaches?
Sure. So again, a headache log is very important because everyone's very individual. So what might affect someone might not affect the other. But there are some things that we do hear a lot in our clinic, especially things like alcohol, caffeine, either too much or too little, aged cheeses, things with a lot of processed or fermented things with MSG. Other things like citrus, dairy, those can be things that can bring on a headache in some. It's kind of hard to know that because we eat a lot of things, so without doing an elimination diet, it can be a little bit challenging to really pinpoint that trigger. But there are some foods that can help migraine too. So I usually tell people keeping a well-balanced diet, leafy greens, lots of omega-3, things that contain magnesium. That can also help kind of prevent or bring down the severity of headaches too, in a part of a well-balanced meal.
How does exercise and meditation, how do some of those more holistic treatments play a role?
So I love this question. So cardiovascular exercise has been shown to be one of the most effective non-medication preventive strategies to preventing headaches and particularly migraine. So what I recommend to my patients is aiming for at least 30 minutes of physical activity, anything that can raise the heart rate, at least 3 times a week. Now, if you're not someone who does regular physical activity, you can progressively work up to that goal. And I always tell my patients, you don't have to run a marathon day 1, but maybe you'll start off doing the stationary bike, or maybe like a Pilates class, or even yoga, just anything that raises the heart rate. But it's very well known to be highly effective at preventing migraines. You had mentioned meditation. That's also very well known to be effective at reducing migraines. We think it's the centering, the deep breathing exercises, the mindfulness that can occur, and all of that has not only a reduction in your stress, but helps migraines as well. And there was even a study that looked at yoga in particular, and it was shown that regular practice of yoga can also reduce migraine frequency as well. So everything you mentioned, non-medication approaches can definitely help migraine and headaches overall.
There's some day-to-day things too that I tell my patients. So screen time is obviously a big trigger for some people. It's not just the lights, it's also the positioning of the neck that can kind of bring that on. So I often have people, instead of they're doing a laptop, maybe do a keyboard and a screen that's right above your face so that you're looking straight ahead. Other things, maybe sleep position might be a factor for some people, especially if you sleep on your stomach and maybe you're craning your neck a little bit. That can be a little bit of a trigger too. So perhaps lying on your back or on your side with supported pillows so that your head is also in a neutral position as you sleep. Those can be helpful too.